My guest in the studio is an expert on Alzheimer's who has been working for years on an international level to help find a cure. Dr. Hans Gutzmann, thank you very much for joining us today.
Hello.
Dr. Gutzmann, we all forget things from time to time. When could there be something more serious? When could there be an early warning sign for Alzheimer's?
When it worries you, when you lose your abilities you're really normally good at. If you're good at telephone numbers and you start to get problems with it, that would be an early sign, for instance.
Mm-hmm. So a change, basically. It's not something that, you've had problems with for a while, but it's sort of a change in your ability to remember things,
a change maybe. That alters your normally life, yes.
Mm-hmm. OK, well, what most of our viewers really wanted to know also during our Facebook chat was who is most prone to developing Alzheimer's?
One group called, for instance, couch potatoes are at risk. People, when their prime of life, are passive, are not active, don't look for challenges, just doing routine for their life. Mm-hmm. Those people are at risk.
All right, that sounds as if your lifestyle has quite a bit to do with it. How important is lifestyle when it comes to Alzheimer as compared maybe to your genetic factors?
I think about 50% of the risk of getting Alzheimer's is in your hands. That activity problems are one, reducing the weight is one point, stopping smoking is one point, and being cognitively active is a point. And okay, looking for your blood pressure or normalize it if it's too high, and looking if you got diabetes and normalizing that, metabolic problems is also reducing the risk for Alzheimer's.
All right, well that means you can do a lot to try and prevent Alzheimer's, as
really
you just said. Yes. Let's speak about what's being researched in forms of diagnostic methods and therapies. What methods for early detection can we look forward to, so to say? What's being researched in that aspect?
There are lots of biomarkers being tested for early diagnosis of Alzheimer's, looking for the pathological byproducts of Alzheimer's in the brain or in the liquor. That gives hints if there is a disease going on or not.
Some of these methods, they're still being researched. They're not available to the public right now. But still, some doctors do offer early detection methods. What's your view on that? Is that credible? Is it worthwhile getting tested now?
Well, I wouldn't think so, no. It's not a serious offer now. For instance, measuring the volume of your hippocampus, where all the memory traces go through, is not a serious offer for now. Maybe in the future will be.
From your point of view, fighting Alzheimer's with an extract from a plant, that seems too good to be true. Is ironwood a credible solution? What's your view?
Well, I think it's very interesting substance. One thing is it does work in mice, and we are looking for the time it works in people. And it has very little side effects. And working at the very byproduct of Alzheimer's and being without any serious side effects, I think it's a good option. So
you would try the tea, is that what you're saying?
Maybe I have tried it already, because it's good for or against flu.
Mm-hmm. OK, so maybe another reason to try and take it.
Might be.
Well, let's speak about other things that are being researched. What other therapies can we hope for? What's in the pipeline when it comes to Alzheimer's?
There are drugs aiming at the energy metabolism. One drug is aiming at another byproduct of Alzheimer's, that is the tau protein, which is in the cells, and might be that is a new possibility of therapeutics. Yeah.
Mm-hmm. Well, what's available now? What can we do now to fight Alzheimer's?
We have just now drugs aiming at the nerve cell transmission between the nerve cells. Cholinesterase inhibitors are one class of drugs, and the other is NMDA antagonists, another class of drug aiming at that point where it lowers the effects of Alzheimer's, but it doesn't antagonize the effects of the disease.
Well, let's be clearer on that. What can you achieve from medications? Can you reverse memory loss?
You definitely can't reverse it. You can stabilize the symptoms for a certain time, for instance, a year or 1.5 years, and that is good as we are now.
All right. Well, one question that many of our viewers have asked or have written to us about is, what can you do as a friend or family member if one of your loved ones suffers from Alzheimer's? One of the viewers that has written in was Brigitte Henning from Chile. She wanted to know what she can do to help.
I think one main thing is to keep the patients in the family, to keep them active, to show them that you still love them. Don't put them aside. The people put aside maybe suffer earlier and at a more active pace. So keep them alive and challenge the people.
So mental activity, taking them on outings, communication,
yes.
those sort of things might help.
To live an active life is good, even if you are still in the process of getting dementia.
Okay. Well, thank you very much for your time. Thanks for being our guest today.